Dr. Stephen Yu joins the show. He's got his practice in New Milford. You're a urologist. He is a local hero because he stopped me from procreating. So people are very, very happy with that.
He is a hero.
And he was Ethan's doctor. That's how Ethan introduced me to Dr. Stephen. He's our buddy, and we're excited to have you here.
Thank you.
Let's talk about COVID-19 first, because you came in here hot with information. You're saying there's just a lot of nonsense kind of floating around in the media and the narrative in social media, which is a disaster right now.
That's the last thing I would use is Facebook or any social media. I mean, there's a website, the cdc.gov/coronavirus. That's a huge resource for people. If you want to know more about the infection, that's where you should go.
What do you think is most important to communicate to people right now as we're trying to navigate through this?
Well, one of the things I wanted to do was just to let your listeners know what exactly is COVID-19. It's a coronavirus, and about 1/3 of all colds right now that people get are caused by a coronavirus of some sort. Now, there are different varieties, and one of the things about this one is that it's novel, which means it's new. And there's been a couple of other ones in the past history that we've dealt with. And everybody remembers the SARS outbreak in 2009.
Right.
Right, and in the MERS episode in 2012, those are also coronaviruses.
Oh, okay, so this is like...
actually, when they...
A spin-off. This is like Frasier.
Well... The virus itself is called SARS-CoV-2. The reason why it had a label 2 in it is because the original one, the SARS-CoV, was the original SARS virus. So this is the number 2, and it didn't want to have any association with the SARS epidemic, so they kind of shortened it up. And because it was discovered in December 2019, they decided to call it COVID-19, which is coronavirus 19. That's how the name came to be.
You think the NBA did the right thing?
Well, I think social distancing is one of the major things about trying to slow down the growth of this virus.
When you say social distance, you mean physical space between people?
Well, that's one of it. But the other thing you want to do is just to prevent people from gathering, because spread from this disease is from person to person. That's usually the major way of contracting this disease is if you're in the room with someone with the infection.
Right. So an NBA arena would be...
just take a look at the cruise lines.
They're saying, do not.
Your microphone wasn't on.
Do not, under any circumstances, book a cruise.
Now, I keep telling my kids, kids it's hard enough to get them to wash their hands as it is. But I said, you should be washing your hands on a regular basis 10 times minimum. I broke it down like this. You wake up in the morning, you wash your hands. You go to bed, you wash your hands. After every meal, you wash your hands. What are we up to now? 5 already, right? You blow your nose, you wash your hands. You touch a door handle, you wash your hands. I said, now I want you washing your hands 12 times minimum.
How they doing with that?
They're kids. They don't listen. But we're every time I'm in the room with them, I'm reminding them, and they go wash their hands.
I just want to make sure everybody realizes this is a respiratory disease, so it's transmitted through droplets. Okay, so it's usually droplets can survive in the air from what they said is about 3 hours right now, and then if it's on a hard surface like plastic or metal, it can last up to 3 days. So that's the reason why you're wiping down everything. Whether it's at the gym, if you're sitting down in the airplane seat, you want to wipe the surface down.
I have a question, a very important question.
Go.
And I've wondered this. I've read up on it, so I think I know the answer, but I want to hear it from Dr. Yu. When is it time to get tested? I mean, you're sitting at home. All of a sudden, you've got watery eyes, your head is stuffed up.
Just remember, 80% of these cases are mild to moderate. So, and there's a significant caseload where if you're over a certain age, it's more deadly. So the recommendation right now is that if you develop symptoms, you should isolate yourself at home, see how your symptoms go. I mean, you develop a fever or you have shortness of breath. I mean, obviously, you got to seek care because that could be leading to a more serious complication.
Is that when you pick up the phone and call your caregiver?
Always let your primary care physician know what's going on, because they'll be able to direct you according to whatever the standards are in different counties and different states. The CDC has who should be tested and who shouldn't be. And as the test gets more widely distributed, it should be more available. But right now, if you're young, relatively healthy, your chances coming down with serious complications are a lot lower. And, just staying at home, the most important thing is not to infect anybody else.
I-95, hello.
It's Ed calling from the truck.
What's up,
Hey,
Ed?
Got a question. I just want to know, as far as, are they being able to treat it, how well they're being able to at least to treat the young? I know the elderly don't have a good chance, but what's the prognosis for younger people?
Prognosis for younger people is pretty good. I mean, 80% of the cases were resolved by themselves. Right now, for those severe cases, they've looked at a couple of new drugs. Well, they're not really new. They've been out for a while, but they're antivirals. Remdesivir is the one that they're looking at right now. But all those things are it's a fluid situation right now.
There you go. Thanks for the call,
Thanks a
Ed.
lot.
Thanks, Ed.
Appreciate it.
You got it.
All right, I-95. Hey, what's up, chicken foot?
I don't have chicken feet, dude.
All right, cool,
Okay,
dude.
cool.
Do you have a question for the great Dr. Stephen Yu? Hey,
So what about then walking in the store, opening the door with the handle in your hand, and
That's
somebody
why
else has done that?
That's why you need to wipe down those handles. I mean, that's the key
Well,
here.
yeah, but I don't work at the grocery store or wherever. So.
no, I think he's saying, like, maybe you carry some, hand wipes with you.
Oh, okay.
Grab
Yeah,
the
okay.
handle.
I got you.
You know what
All
I'm
right.
saying?
Yep.
Thanks for the
Have
call.
a good one, brother.
Thanks a lot. Bye.
Morning, Ethan and Lou, I-95. Hello? I think line 3 is broken.
Oh, line 3 is broken.
I-95, hi, do you have a question for
Hey, what's
Dr.
going
Yu?
on, ball bag?
Yeah, I've got a question. Why is there so much focus being put on this virus versus the common flu? Back in 2018, 80,000 people died of the common flu in the U.S. Is it because the mortality rate is about 2% for this virus versus 0.1% for the flu, and can you treat flu differently than this virus?
Well, for the flu, they have flu vaccines. So one of the things about this is that for those of you who haven't had your flu vaccine, that's the strongest recommendation I can give right now. Get your flu vaccine. The reason why this virus is so dangerous and why everybody's is that there's a lot of unknowns. It's a novel virus. I mean, it's new. The last two novel viruses that we've had, I mean, they were self-limited. They went away with the SARS and the MERS epidemic. And this one seems to be highly contagious. That means you can give it to somebody easier and not know it, especially if you have a mild case. And in the risk patients are the elderly, the medically compromised. If you have an underlying medical condition like diabetes or lung disease, I mean, you're at risk.
Thank you for the call, brother. Appreciate it. That's right. Now, you compared this off air to H1N1, the swine flu, right?
Well, remember, the WHO declared this as a pandemic yesterday. So the last time the WHO declared a pandemic was with the H1N1.
And you were talking about flattening the curve. That's where we need to go with this, because I wanted to know the end game. How do we get on the other side of this so we can all get back to normal life, at least?
Well, flattening the curve is an epidemiological term for trying to delay the number of cases so that we don't have a spike. And the way you're going to do that is, decrease the transmission rate between person-to-person contact, which is what they're trying to do now by canceling all the sports events, banning, like cruise travel. Or right now, I think Trump just banned all Europe to U.S. travel for another month.
And that will help, you're saying?
Well, that'll help because it'll decrease the acute number of cases that end up in your hospital system, and you can overload your hospital system. So you want to try to decrease that and push it out so that way your healthcare system can handle them out. And look at Italy right now.
Yeah, and you said the death rate is kind of deceiving right now because the diagnoses can't all be made. We don't know how many are out there. So.
Well, the diagnosis, remember, a death rate from a certain disease is the number of deaths divided by the number of cases that you find. And right now, we're not finding every single case.
So the death rate looks bigger than it should.
Your numerator is probably going to stay the same, but your denominator is going to get increasingly bigger. So therefore, if that happens, your death rate will go down. But only time will tell right now.
So if we can simplify everything that was said this morning, kind of just turn it into bullet points.
Right.
It's wash your hands, avoid large crowds.
Right.
Surfaces is where it can stay for up to 3 days. Hard surfaces, metal and plastic. So you want to wipe those things down. In fact, in a very specific matter, I think this was a helpful piece of information that you gave out when that guy called was he asked about going to the grocery store and grabbing the handle. Well, I carry baby wipes. Maybe that's not the best way, but if you have something protecting your hand from the handle just in your pocket, that's a helpful way to do it.
This is raising awareness of what you can do to prevent transmission to others is the key here.
Let me show you who's raising awareness. Look at this lady right here. She's on a campaign to raise awareness, and she's got a wash your hands sign. Her name on the Instagram there is that boosted chick, and she's wearing a mask. She's just telling people wash your hands. Bikini. Very helpful.
Well, you have to look at it in perspective. Right now, for the general public, healthy general public, you're probably not going to be affected as much as. But the problem you're going to look at is your fathers, your grandfathers, the people in your family who are at risk. I mean, and you don't want to spread it to people who are going to suffer greatly from this.
So you see how he danced right around that bikini lady thing? He didn't even address it.
Right.
He kept it on the up and up. He kept it nice.
He's had enough of our foolishness.
Because he's a professional.
Yeah. Right.
Dr. Yu, we appreciate your time. Is there anything else you wanted to get out there before we let you go?
Just be extra vigilant in terms of the way you greet people nowadays. Handshaking is probably not the greatest thing you want to do. Fist bumps are probably the best.
We do a bow. We were doing bows yesterday.
Yeah, we can even do the Star Trek, Spock.
That's right.
Yeah, you can do anything you want.
I can do it. Mm-hmm. We could do West Side. See that? But I had to manipulate my fingers with my other fingers before I do it.
Yeah.
And wash your hands. That's a key to everything. Yeah, just keep your hands clean.
There you go.
Don't touch your face.
Well, that's impossible. They had the doctors on TV the other day talking about how you can't touch your face, and then they counted the amount of times that the doctors giving this advice touched their face during the interview. This is nuts.
And the last thing I want to make sure that everybody knows is that buying face masks is probably not the best idea. Unless you're the person that's physically sick, you shouldn't be wearing a face mask.
Why is that?
Because you're more likely to touch yourself. And those face masks that you can buy on Amazon probably are not going to protect you from the droplets anyways.
There you go.
So unless you have it, enough with the face masks.
Right.
Thank you, Dr. Stephen Yu. You're the best.
Thanks, Doc. We really appreciate coming in.
Thank you.